Hey guys, it's Garrett again. I had a question yesterday about doing some squatting. Young guy comes up to me and he goes, "Hey, my back is hurting me when I squat." I said, "Okay, let me see what you look like when you squat." So he does a squat and not that great, needs a little bit of work, not too bad. I mean, could be way worse. So I'm asking him, okay, does your back hurt when you deadlift? Well, yeah, my back hurts when I deadlift. Okay, does your back hurt when you do other things or when you stretch? Yeah, a little bit. Okay, so your back doesn't hurt when you squat, your back hurts all the time. If you're having back pain where it feels uncomfortable most of the time or all of the time, you need to address it. There's no such thing as a pain fairy. You don't just do nothing and all of a sudden have pain. When you have pain, it's something that you did to yourself. You either trained too much without enough rest, you sit funny, you walk funny, you sleep funny, you're eating foods that inflame your joints, you're doing something that's causing your pain. It could be a lack of flexibility, and it could be poor posture teamed together that are just giving you imbalances. There's just a number of things. So you need to find out what's causing the pain, because it's not magical. A lot of people think, "Ooh, I've got wrist pain. It's just a thing. It magically appeared. I did nothing." You did something. You did something to hurt your back. You did something. Okay, let's figure it out. First of all, you want to try to fix imbalances. What I'm going to do right now is kind of a base program, something that you can do to help yourself if you've got lower back pain. This will somewhat fix the problem. It could fix the problem if the problem happens to be flexibility or if you're hyper tight in a lot of these areas, which is what I find to be true. Okay, so first thing, if you're having lower back pain, you need to evaluate your posture and see if your hips tilt. You may have, I hope that you can see this, you may either have what would be like a duck butt, or you might be hyper tight this way. Odds are you're probably like this. You've probably done a lot of deadlifts, you probably don't stretch enough, your hamstrings are probably tight. When you do a lot of your lifts, you'll notice if you're standing there, you happen to be like this all of the time. No matter what you're doing, your spine is resting on itself. You need to, first of all, tighten up the very lower part of your abs into your hips. I really hope that you can see this, because I don't want to re-record it. You need to tighten up your hips, really work on your lower abs to pull that back in. That's going to be step number one, okay? Step number two is a series of stretches and warm-ups every day before you work out, and even at night. I do these all the time. First stretch is going to be just a stretch. You need to loosen up your hamstrings. I also like to go out to the side, rotate this way, go out to the other side, rotate that way. Gives me a little bit of a rotation in it too. This is the most important one right here. I cross over, I'm getting all dirty for you guys. Cross one foot over, put your hands here depending on how flexible you are, and pull that up. And you're really going to feel this all through here. Ooh, that feels so good. You should do this probably to warm up if you're hyper tight, also to loosen up, just to stretch. That's going to be one of the stretches that really loosen you up through there, okay? Another thing that you need to do as you're warming up for your day of your workout, a little bit of yoga. When you do this, squeeze all the way into your crotch, all the way, squeeze everything, get nice and tight. When you're here, pop it. Oh, everything's tight. Back up this way. Drop it out right here. Oh, it feels so good. Okay. I would do that little series, the yoga poses. I would do that hip warm up. I would also do rollovers, depending on how flexible you are. Give this a shot. You're going to go over and up. I like to throw a little stretch onto it. Over, up. Okay? Do those to warm up every day, whenever you're going to do, damn, I'm dirty. Whenever you're going to work your back. Warm it up really well, stretch it out. You're probably too tight. Do the stretches at night. Okay, now we're going to get into a little bit of rehab, try some decompression. Get a decline bench, lay on the decline bench at a good decline or upside down. Try to do some decompression on your back a couple of times a week, at least, maybe 3 or 4. I try to do it almost every day. Same thing a chiropractor will have you do. Get up, get your knees elevated. You can use an inversion table, a decline bench, whatever you want to do, and hang, decompress, okay? Second thing for therapy would be foam roll. Foam roll out your back, get it nice and loose. It's going to substitute for a massage. If you can afford a massage, get a massage. You need to ice and heat your back. Don't just ice and don't just heat. The ice will reduce the blood flow. You need to basically push out the old blood and inflammation, and you also need to bring in new blood. So, ice it and heat it, kind of alternating, but do that regularly, even when it doesn't hurt. Go ahead and do that. Massage it out, roll it, decompress, and stretch. The biggest thing you need to do is attack it. If you just let it go and you hem and you haw and you, well, I'll give it a shot, let's see what happens, you're going to fail. It's just like anything else. Dedicate to making it better. Realize that you have more control over it than you think you do. And just take responsibility. Just get better. Decompress, ice, stretch, roll it out, get your massages, do the stretches I showed you, and just take it serious. Also, you need to check your form on any exercise using your back. A couple of good starting points just to evaluate where you're at. Sit at 90 degrees, right here. Do a perfect 90-degree angle and see what you look like. If your hips, you can't even get your hips up. If you're sitting like this, and this is as much of a 90 degree as you get, my hips are like facing this way. I can't even sit up. If you can't even do this, why are you trying to deadlift 400 pounds? If you don't even have the structural integrity to sit, I would probably work on that before anything else. So that's it, guys. I'm probably rambling a little bit because this is something that afflicts a lot of people, and the answer is the same for a lot of people because they don't have the flexibility, the structural integrity. And it really makes me mad because I feel like nobody ever listens to the advice. They don't ever take the steps to fix it, either because they feel like they don't have control or they think it's too simple and it won't work. It will work. Stretch it, foam roll it, ice it, decompress it, heat it. Follow those steps. Take care of your back. You can make it feel better. Do this preemptively. Even when your back doesn't hurt, if it's bugging you, whatever, after it bugs you and it hurts and it feels better than in the future, continue to do this stuff. Don't just let it go. If you've got more questions about back stuff, just put a little message in. I can get a little more specific with some of the stretches or add some more stretches to it, but I already feel like this video is too damn long, so thanks for watching.